What do patients and caregivers really need to know about precision medicine?
So there are some cancers that are defined by a single mutation. You have chronic myelogenous leukemia, CML, which until Gleevec, patients had a very, very poor survival rate. Now they are functionally cured. The vast majority are on Gleevec for the rest of their lives and live out pretty much a normal life. Multiple myeloma is very different because there are many, many different mutations. Often it's said multiple myeloma is not one disease, it's 10 different diseases. So far there have been two major classes of drugs, the proteasome inhibitors and the IMiDs, and they work virtually for everyone. The challenge is that for some patients they do really well and they can be on these treatments and their disease responds for a long time. Others may respond for a short time and then they're on to the next treatment. But those are considered backbone therapies that can really benefit all patients. Two of the most recent drug approvals in the last couple of weeks are antibodies. Those also seem to have widespread applicability. So, what we're finding in myeloma is that we are able to see amazing gains. Survival has more than tripled since the time the MMRF was founded. But what's happening is different types of patients are relapsing faster than others or may not be responding to certain classes. So what's really important is to start to collect data. And what we're doing through our longitudinal COMPASS study is we are following 1,000 myeloma patients. They've all been enrolled in the study. Prior to treatment, take a bone marrow biopsy, do whole genome and whole exome sequencing to understand what their disease looks like at the deepest possible level, collect their clinical data, follow them for at least 5 years, most likely 8 years or more, and every time there's an event like a relapse, do another bone marrow biopsy and sequence them and start to see how does the disease change over time. We're putting all of that data into an open source platform called our Researcher Gateway, where researchers anywhere can look at this data and say, you know what, I'm interested in patients who have this specific genomic alteration. How do they do on standard therapy, which is an IMiD, proteasome inhibitor, and steroids? And all of a sudden you can see, okay, there were 400 patients in the COMPASS study, and here's how they did. But if you tried this treatment over here, you could say, oh, they did poorly. So you know what, if I had a patient who looked like that, I'm going to put them on the first therapy. Because there's so many questions right now, particularly with all these new drugs, who should be on which drugs, which combinations, and in which sequence.